Hello everyone, good afternoon. Welcome to lecture 44 of BMS 300. So today we'll be continuing our discussion on the digestive system, and I know you have questions about exam 3 performance, and we'll discuss it at the end of class, right? So last 5 minutes I will have some few comments on this. So I'll just quickly show you the slides which we discussed on Friday, and the recording will be up there, so I'll just tell you an overview of what we discussed in each of these slides. So in this slide we talked about how the digestive system is going to fit in with the functioning of the other systems, or how it can be influenced by the functioning of the other organ systems. So in today's class we'll be talking about mainly the 3 phases of digestion. We'll talk about the cephalic phase and the gastric phase, and that's how far we'll get in today's discussion. But in terms of what's happening in the mouth, we'll see how saliva and chewing or mastication is very important. We'll also see how the tongue can play a role in chewing, and we'll discuss how dental caries can happen as a lack of saliva production, and we'll see what are some methods which can be used to prevent dental caries. And then we'll move on from the mouth down to the esophagus to see how the ingested food is going to move into the stomach, and we will also discuss about how choking can happen, and we'll be able to appreciate how sword swallowers do what they are able to do, because we understand the functioning of the upper part of the digestive tract. And we'll discuss about a condition known as GERD, also called acid reflux in common language. And when we move from the esophagus down to the stomach, we will be talking about what are various secretions in the stomach, how mixing happens in the stomach, and we'll talk about what are the factors which influence the stomach contents to move into the small intestines in the next lecture when we come back on Wednesday. But before we get started, this is a slide we went through on Friday, where I told you how it is the parasympathetic activation of the autonomic nervous system which will ensure optimal digestive function. So we will see how the eyes can be influenced, how the salivary secretions are affected, and we'll also take a look at how the vagus nerve will influence a number of secretions along the digestive tract. On Friday we also considered the differences between the gastrointestinal tract and the accessory organs. So I highlighted, we talked about that as well on Friday. So today we'll start with the 3 phases of digestion. The first phase is the cephalic phase, which is related to the head, and the cephalic phase starts even when you think about food. You may not be near food, but if you think about food, that triggers the cephalic phase, and the end of the cephalic phase is when you swallow your first mouthful, right? And the gastric phase is when the ingested food gets into the stomach, and the gastric phase will end when the food moves from the stomach into the small intestines. And we will consider what happens in the cephalic phase today, and also we'll get into parts of what's discussed in the gastric phase. So the cephalic phase is pertaining to the head or the oropharynx, right? I told you the pharynx can be divided into 3 parts: the nasopharynx, oropharynx, and the laryngopharynx, but the cephalic phase is related to what's going on in the head and in the oropharynx. And the cephalic phase is the response to food-based stimuli, right? And these food-based stimuli, they're going to be neurally mediated through the parasympathetic nervous system. And the food-based stimuli could be based on what you see, and that is of course used by advertising companies to make you want to buy their products more. It could be based on what you smell. Have you seen the sign outside Jimmy John's, free smells, right? So that is also food-based stimuli. and then it could be based on what you hear, and the advertising companies will also use this stimuli as well. But the bottom line is, when you have the cephalic phase, there will be two types of responses which we will consider, right? The first is the secretory response, and the secretory response can take place in your mouth through the salivary glands releasing their secretions. It could take place in the stomach. We'll see what are the various gastric secretions, and we even notice that the duodenum, which is the first part of the small intestines, will release some secretions, and the pancreas also plays a role in this as well. So all of this is happening before the food can be swallowed. The second type of response during the cephalic phase is the non-secretory responses, and this is mainly referring to the contraction and the relaxation of the muscles along the gastrointestinal tract. So this could lead to the mixing of the ingested food in the stomach, and also in the movement of the ingested food through the gastrointestinal tract. So both these responses will take place during the cephalic phase. Now, the bottom line of why the cephalic phase is important is to improve and optimize the efficiency of both the digestion and absorption of the ingested food, so that we can get the maximum amount of nutrients from the food which was ingested. So that's what takes place in the cephalic phase. Now, we know that there is a condition called COVID-19 where the cephalic phase can be impacted, because we find that the taste and smell could be affected when you have COVID-19, right? And so as a result, when you have smell and taste affected, it can have an impact on the overall cephalic phase, and that can influence how much food you eat. So the suggested mechanisms for how the cephalic phase is influenced by COVID-19 is that you have a decrease in the reward sensing pathways, and so you don't have a desire to eat as much food. If you can't smell it, you can't taste it, and you also have less food being ingested because you don't have as much of a desire. And lastly, you have this sensory specific satiety, right? So for a given sense, you start feeling satiated, and what we mean by satiated is that you feel full and you don't feel like eating anymore, and so that can lead to premature termination of how much food you consume. And so we find that when you have the cephalic phase affected, it can lead to reduced food intake, and that can lead to different kinds of deficiencies. So now let's talk about the importance of saliva, right? So we see that saliva is mainly made up of water, but there are also these glycoproteins which make the saliva viscous, and this viscosity is a pretty important characteristic of saliva, because it's going to hold the chewed particles of food, so that it's going to be easier to swallow. If you try to swallow just powder, you can choke on it, can be pretty difficult, and so the saliva mixing with the food and lubricating it makes it easier to swallow, right? So it may be a bit annoying in terms of drooling babies, but it does have some important functions, right? And one of the main components of saliva, in addition to the glycoproteins, is that it's got enzymes in it, right? One of the first enzymes we consider is the amylase enzyme, which helps to break down starches into simple sugars. So if you were to take a raw piece of potato and you put it in your mouth and you keep it there for some time, initially it may seem tasteless, but after a few minutes it will start tasting sweet, because the starch in the potato is going to be broken down by the amylase enzyme, and you are tasting the sweet taste and flavor in a few minutes. There is also lipase enzyme, and this will break down the triglycerides into fatty acids and glycerol. So notice that when you think about the three macronutrients, carbohydrates, proteins, and fats, carbohydrates and fats are being, the digestion is beginning in the mouth, right? But for proteins, the digestion will only start in the stomach. So saliva is also important for taste perception, and so this was a study done a long time ago, right, in Israel in 1979, where they looked at the facial expression of babies who are just 1 hour old, not 1 year, 1 hour old, and they saw how they were having facial expression changes when they gave them different flavors. And the purpose of the study was to see if the tastes which we can which we appreciate is something which is we are born with, or is it something which you are trained to appreciate, right? And so here are three pictures of babies. This is their normal controlled face, and see how they respond when you give them something sweet. You notice this baby is smiling, and the baby on the above hand looks pretty happy. And notice how it changes when you give them something sour, right? They start puckering and they don't look as happy. Have you seen videos of parents giving kids lemon wedges? And yeah, I'm guilty of that too, right? So, but when you give them something bitter, notice that they're turning away from the bitter taste, right? And they are totally not happy at all. And so we see that in nature that sweet taste is a surrogate for calories, whereas if something tastes bitter, it could most likely be poison, and if something is sour, it could indicate that it has been spoiled, right? So these are tendencies which we are born with, right? And so we see that for tasting, saliva has to play an important role in taste perception. Another function of saliva is the fact that it has antibacterial properties, right? And a reason for this is the presence of the lysozyme enzyme, which can break the bacterial cell wall, and so that's why it can have antibacterial properties. And here's a trigger warning, right? I'm going to show you a picture of what happens if you don't have saliva secretion, right? And this is a picture of a 25-month-old bottle-fed baby, should be called a toddler at 25 months old. And so this is a condition known as nursing caries or the nursing bottle syndrome. And this is caused when when babies go to sleep with a bottle of milk or juice. And initially this is not a problem. When the baby is still young and doesn't have teeth, you could use this method to put them to sleep. But then as they get older, we see that the sugars in the milk can start getting accumulated on the teeth, and the bacteria can start leading to these nursing caries. And the reason for this is that when you're sleeping, the salivary flow is going to be suppressed. And I told you that the saliva has got a lot of enzymes in it, and making it will require energy from the body. And so unless the body has the cephalic phase being activated, it's not going to produce saliva as you're sleeping, right? And so because you have less saliva as you're sleeping, there's less antibacterial activity, and so if you have more sugars in the mouth when you sleep, it can lead to these cavities. So I think your question will be, why is it we drool when we sleep, right? If we have suppressed salivary flow, this could be due to a couple of reasons. Reason one, you may be thinking about food while you're sleeping, depending on what your previous experience was during the day, or the facial muscles can also get relaxed as you sleep, and your mouth could open and saliva could flow out, right? So those are some reasons why we drool while we sleep. But let's consider what is the mechanism behind why having too much sweets could lead to dental caries. So dental plaque is the sticky colorless biofilm which will form when the bacteria in the mouth can mix with the sugary or starchy foods. So that is what is the dental plaque. And whenever you brush your teeth regularly, you are getting rid of this dental plaque so that the bacteria can't proliferate and multiply. But if you don't adequately get rid of the plaque, the bacteria can break down the sugars using what type of metabolism? Does it use aerobic or anaerobic metabolism? How does it break down the sugars? Anaerobic, yes, very good. Because it's using anaerobic metabolism, the byproduct will be lactic acid, and as the teeth are bathed in the acid, it can lead to calcium loss, and that can affect the structure of the enamel, and that can lead to tooth decay. So dental caries, they are one of the prominent public health concerns according to the Global Burden Disease published a few years ago, and the main cause for this could be the high intake of free sugars, right? What we mean by free sugars is these are sugars which are found in processed foods. It's not referring to the sugars in fruits, and that's one reason. So as you have more of these free sugars, and also a lack of removal of the plaque by adequate brushing of the teeth, that can also increase the risk, and using inadequate fluoride toothpaste, or not having enough fluoride in the water. So all of this can increase the risk of dental caries. So notice this, that it's like a tug of war where you have bacteria and sugars on one side increasing the risk of cavities, whereas saliva, fluoride and proper tooth brushing decreasing the risk of cavities. So let's consider what happens when you use a fluoride toothpaste, or you have fluoride in the water supply. So on the left hand panel we have hydroxyapatite, which is the tooth enamel structure, and notice that it's mainly made up of calcium and phosphate ions, and in the middle you have this hydroxyl group, right? That's why it's called hydroxyapatite. But when you use fluoride in your toothpaste, we see that this hydroxyl group will be replaced with fluoride in the middle, and now it's called fluoroapatite. And the importance of fluoroapatite is that it's going to make the enamel much more stronger, and will help to decrease the risk of tooth decay, because just the structure is different, it will make it stronger. And so we find that there is political controversy, right, on should we do community water fluoridation or should we not do it. And whenever you have policies involved, there will be money involved as well, and when money is involved, people will get upset, right, if you pinch their pockets. So what are some of the arguments against community water fluoridation, right? As a person who lived in Ithaca, New York for more than half a decade, I appreciate the importance of community water fluoridation. They don't have fluoride in their water supply. So from personal experience and from experience of people who I know, we would highly recommend using fluoride toothpaste if you're ever in a place where there's no fluoride in the water supply. So what is some of the arguments given against community water fluoridation, right? So one argument is that this is a way of mass medication, right? If you give people medicines, you should take their permission, and adding fluoride in the water is unethical because you're mass medicating without taking people's permission. So that's one argument. Others say it is plain harmful, right? I don't know how they say that. And others say that these industries, right, which are engaged in nuclear and in nuclear products, and also in producing aluminum, they will dump toxic waste if you have community water fluoridation. I have absolutely no clue how they came up with this argument, but that is one of the arguments which are put forward. Others say that the water should be pure, should not have anything added to it. But if you try to drink distilled water, you would disagree, right? What gives water its flavor are the various minerals which are dissolved in it. Others say that fluoride makes the water taste different, and this is the best argument of all, the last one, right? Adding fluoride to the water will lower the IQ, right? And here's a study which was published in 2012 which seems to support this claim. And whenever you hear about studies, right, you want to dig in a little more to see how did they come up with this specific conclusion. And so what they looked at in the study was they were looking at places where fluoride was naturally occurring in the environment. And whenever you have naturally occurring fluoride in the water, there's no regulation on what is the level of fluoride in the water. So that is one concern. Secondly, the study was done by looking at places where it was in developing countries. And we know that a person's IQ is greatly determined by what environment you're in, right? It depends on what resources you have, and in a developing nation you may not have as much educational resources, and so this was not a very good comparison of IQ and the relation to community water fluoridation. And so there was this other study done in New Zealand where they looked at people living in places where there was community water fluoridation and no water fluoridation, and they looked at children at the age of 7 to 13 years, and they carried out these IQ tests, and then they carried out a test on these same individuals when they were 38 years old. So after many years they checked their IQ, and again there was no statistical difference, right? And so we understand that community water fluoridation is beneficial, and there's no known adverse effects to using that. So then we can ask other fun ways in which we can decrease the risk of dental caries, right? So there is this sweetener called xylitol, which is obtained from plants, and this has an effect of increasing the pH, right? And that's the opposite of what the bacteria in your mouth does. That will decrease the pH and cause calcium to leach out. So in Thailand there's a study done on children, and they gave them these xylitol chewing gums to one group, and the other group didn't have these gums, and they found that in the treatment group the risk of developing caries was significantly lower, right? So that is another way in which we can decrease the risk of dental caries. So while we're on the topic of chewing gum, there is a term scientifically used for chewing, and that's called mastication, right? So mastication or chewing, it's not as simple as we think it is. It's going to involve the alternated, symmetrical, rhythmic and coordinated movement between the two sides of the dental arches. So this is not something very simple, because the tongue is also involved. It has to move the food from one side of the mouth to the other, all the way making sure that it doesn't get chomped on, right? So it is true that the entire brain is involved in chewing, right? And we don't appreciate this until you're not paying attention and you accidentally bite your tongue, right? So mastication is something which is pretty complicated, but we can take it for granted. Now the good news is we're not going into the details of what are the neural pathways involved in mastication, but I do want to tell you what is the relevance of mastication as far as the digestive function is concerned. So what happens is when you chew the food, you're going to increase the surface area to volume ratio, right? And please pay attention to this, because it's easy to trip up when you're asked a question like this on an exam, right? So notice these three cubes here. You have the largest cube, it has the greatest surface area. It also has the greatest volume when you compare it to the other two cubes. The smallest cube has the smallest surface area and the smallest volume. But if you take the surface area to volume ratio, notice that it is the smallest cube which has the highest surface area to volume ratio, whereas the largest cube has the smallest surface area to volume ratio. Okay, so by mastication you are increasing the surface area to volume ratio, and that will help the digestive enzymes to better act on the food particles. So that is why when you are cooking meat, if you're taking a big chunk, you want to make slits in it so that you increase the surface area to volume ratio, so that all the marinade can get in and ensure maximum flavor. So once the saliva mixes with the chewed food, it's no longer called food, but it's called the bolus, right? That is the technical term used to refer to the food which has been chewed on and it's mixed with saliva. And now we can move on to consider how does swallowing take place. So this is a figure we may have seen previously, but let me highlight a couple of things in this figure. So here's the hard palate, and behind that you have the soft palate. We walked through the hard and soft palate when we discussed the respiratory system, and the tongue is shown here and the bolus is in the mouth. So when you swallow, the first step is that the bolus is going to be compressed against the hard palate, and that is done by the tongue. As the tongue is elevated, it's going to compress the bolus against the hard palate, and the elevation of the tongue will help move the bolus into the oropharynx, right? So the nasopharynx is the part connected to the nasal cavity, and I said that the soft palate is going to demarcate the nasopharynx from the oropharynx. And as you swallow food, this soft palate is going to seal off the nasopharynx. And this is actually pretty important, because if you are, let's say, drinking some water and someone makes a joke and you aren't paying attention, this seal is not going to hold, and in fact it could result in this. It could result in the fluids being shot through your nasopharynx, right? Has this happened to anybody? Yes? It's pretty uncomfortable, right, when it happens. So we can appreciate our soft palate for what it does when we swallow. Okay, so moving on, we find that this bolus, when it gets into the oropharynx, it's going to trigger some reflexes, and that will cause the bolus to be moved into the esophagus. So the esophagus is right here, and it is very critical to see that the epiglottis shown here is going to bend over the glottis, and that will prevent the food from entering into the larynx and the windpipe. And so it is the epiglottis which deflects the food into the esophagus rather than into the windpipe. So do you remember what the epiglottis is made up of? What is its composition? What type of tissue is it? Muscular tissue, connective tissue, epithelial tissue? It's cartilage. What type of cartilage? Elastic cartilage. Yep, it's elastic cartilage. Very good. So if this epiglottis doesn't do its work, we could end up with choking, right? And in such a case, you would need the Heimlich maneuver to save your life. So let's see a quick video on this.
It can happen in an instant. 1 minute there's friendly conversation around the table, the next minute someone's choking. Are you okay? According to the National Safety Council, roughly 5,000 people die from choking each year. Josh Mockley, the Mayo Clinic cardiac nurse, says when you see someone choking, it's important to remain calm as you let them know you're about to help.
So you want to place the thumb side of your fist against the person's abdomen, and then you want to apply the other hand on top of that, and then sharply apply pressure to relieve the air.
It's called the Heimlich maneuver. 1, 2, 3. Mockley says to repeat the process until you see the object they're choking on come out of the person's mouth. 1, 2, 3. Are you okay?
Oh, yeah, thank you so much.
Yeah, you're welcome. Glad you feel better. If the person loses consciousness before the object comes out, make sure someone calls 911 for help while you continue to work to clear the person's airway. 1, 2. For the Mayo Clinic News Network, I'm Ian Roth.
Okay, so we find that choking occurs when a foreign object is going to lodge in the throat or the windpipe, blocking the flow of air. So if you know how to do the Heimlich maneuver and someone is choking and you ask them, are you choking? And they say yes, please walk away. And the reason I say that is when you are truly choking, you will not be able to talk, right? So you may feel an irritation in your throat that you may be choking, but if you're truly choking, you can't speak. And so this Heimlich maneuver will involve standing behind the person who is choking and performing J-shaped thrusts in the abdominal region, right below the sternum. And specifically in the case of pregnant people, it can be more complicated because you're trying to save 2 lives, and so you want to go directly under the sternum, right, so that the fetus is not affected. So assuming that no choking takes place and you swallow properly, we find that in order for the bolus to move through the esophagus, you need the pharyngeal muscles to act. So they need to contract and relax to move the the bolus through the esophagus. And the way the bolus is going to be moved down to the stomach is going to be through this peristaltic wave, right? So we know in a wave there's a crest and a trough. Similarly, in a peristaltic wave you will have contraction and relaxation. So let's take a look at what do we mean by peristalsis, right? So peristalsis is the involuntary contraction and the relaxation of the muscles of the digestive tract, and it's going to create this wave-like movement to push the bolus along the digestive tract. So let's see how this happens. So if this is the bolus shown here as the green ball, you will have contraction happening right behind the bolus, but in front of the bolus you will have relaxation, right? So right behind the bolus you'll have contraction and you'll have relaxation, and that pushes the bolus forward, and then immediately behind the bolus there'll be contraction, in front of it there'll be relaxation, and that's how the bolus will be moved along the digestive tract. So here's a question: do you think you can swallow something while you're standing upside down? Yes or no? Yes, absolutely, because it's not gravity which is moving the bolus down the esophagus, but rather it is the peristaltic contraction. But I wouldn't recommend you trying to swallow while upside down, but it can happen, right? So as the bolus goes down the esophagus, it's going to come in contact with the lower esophageal sphincter. So there is a sphincter muscle found higher up in the esophagus, right? That's called the upper esophageal sphincter, but the muscle which is close to the stomach is the lower esophageal sphincter. Now the sphincter muscles are circular muscles which will guard cavities, and it is going to be usually very tight, but when the bolus comes in contact with the lower esophageal sphincter, it will loosen and the bolus can enter into the stomach. So there can be problems in the lower esophageal sphincter, and sometimes you may need surgery to fix the lower esophageal sphincter, but even the surgery can lead to complications, and you could have acid moving from the stomach into the esophagus, and this is the reason why you want the lower esophageal sphincter to be tightly closed, so that the stomach acids don't move into the esophagus. And if this happens too often, more than twice a week, it's termed as the gastroesophageal reflux disease, also abbreviated as GERD. Now there are a few ways in which this can be treated. One of it is by just taking antacids, which will help to neutralize the stomach acids. The other ways, namely the H2 receptor blockers and the proton pump inhibitors, both of those are two different ways in which it can decrease the acid production, right? We won't get into the details of what is a H2 receptor blocker or the proton pump inhibitor, but let it be enough to know, it's enough for you to know that both will help decrease the acid produced. Now, understanding the structure of the gastrointestinal tract as far as the mouth and the esophagus is concerned will actually help us appreciate a dying art called word swallowing, right? So let's watch a quick clip on this on Britain's Got Talent on what word swallowing is. Yeah, please don't try this at home. Okay, great. If you want to watch more of the clip, I'm sure you can find it on YouTube. Right. So if you notice, the first thing for sword swallowing is that there has to be a hyperextension of the neck. Right. That's what we saw in the video as well. And the reason for the hyperextension of the neck is that the mouth has to align with the pharynx and the esophagus. So you want to straighten it out, and that's why you hyperextend the neck. And the tongue has to move out of the way, and notice that there's this upper esophageal sphincter shown right here. And as the tongue moves out of the way and the throat relaxes, the sword can be aligned with the gastrointestinal tract and the esophagus, and it can be slowly lowered down. And of course, this sword would be lubricated to ensure that it doesn't cut the gastrointestinal tract. And one of the major challenges in performing this feat is to overcome the gag reflex, because the gag reflex is something which is very innate, and you will try to spit something out if it touches the back of your throat. And so to be successful in sword swallowing, you need to be able to overcome this reflex. So with that, we move on to what are some of the secretions which are released in the stomach during the cephalic phase. So as we know that the cephalic phase will be triggered by the sight of food, smell of food, taste, or even thoughts, and the central nervous system is going to activate the vagus nerve, and that will innervate different parts of the digestive system, including the stomach. And we see that there are a number of secretions released in the stomach as a result of this vagus nerve stimulation, right? And I don't need you to know the names of all these cells and what they release, but I would hold you responsible for what are the secretions and what is the functions of those secretions. One of the first things released is the mucus in the stomach, and the purpose of this is to coat the walls of the stomach so that it is not going to be affected by what is released next. And what is released next is hydrochloric acid, and without this mucus secretion, the wall of the stomach can be damaged by the acid. Now the hydrochloric acid can also activate pepsinogen, which is the inactive form of pepsin. If pepsin was directly released into the stomach wall, it can break down the proteins in the stomach wall. So you want it to be released in this inactive form, and hydrochloric acid can activate it into pepsin. There is also ghrelin being released. So ghrelin is known as the hunger hormone, and this is produced when the stomach is empty, right? And as the stomach starts getting full, the ghrelin levels drop as well. So we understand that ghrelin will help us to eat as well. And finally, notice that gastrin is a hormone being secreted as well, and we'll understand the implications of gastrin when we talk about the gastric phase. So notice that in this figure here, the stomach wall is empty. There's nothing inside the stomach. But in the gastric phase, we see that the stomach is filled with the bolus which came in, and the gastric phase starts as the food enters the stomach. And as the more and more bolus enters the stomach, we see that the stomach walls will be stretched, and that will activate the stretch receptors. We talked about different types of stimuli for the neurons, and we talked about mechanical receptors, and these, you see, stretch receptors are being activated as the stomach wall stretches. And notice that the gastrin secretion is going to increase as the stomach wall stretches. So the stretch receptors will also lead to gastrin being released. And notice here there are three green arrows showing you what gastrin does. So gastrin can act to release more pepsinogen and hydrochloric acid, and both of those will together lead to increased protein digestion. So as you have more pepsinogen released, the hydrochloric acid will convert it into pepsin, and that can help in protein digestion. Thirdly, notice that the gastrin is also going to increase the mixing waves, which are the contractions of the stomach, and that helps to mix the stomach contents, and so all of the enzymes which are released can act better on the stomach contents. And we also see there will be gastric motility, which will help move the stomach contents into the small intestines as well. So all of this is possible through gastrin. There will also be gastric lipase produced, which is not shown in this picture here, but do you know why we need gastric lipase? You already have salivary lipase. Why do we need gastric lipase? Yes?
I actually know this. So assume you have a dietary fat, usually triglycerol, triglyceride. In the mouth, salivary lipase is going to begin cleaving off some fatty acids from the stomach. However, it's not always done because fats are more difficult to digest. So in the stomach, it's going to keep on breaking it off.
What is the difference? Sorry for interrupting, but what is the difference in the stomach environment versus the mouth environment?
A lot more acidic.
A lot more acidic, right? So bottom line, thank you for that explanation. Yeah. But the bottom line is that the stomach contents are very acidic, and so you need lipase, which is functional in an acidic environment, and that's why you need gastric lipase. You also have intrinsic factor produced. So this is a type of glycoprotein which will bind to B12 in the ingested food, and that can play a downstream effect on the small intestines, right? So in the small intestines, B12 will be absorbed, but without this intrinsic factor, it can't be absorbed. And this is seen in those with gastric surgeries where they have part of the stomach removed. They would need to take intrinsic factor to help with B12 absorption. So moving on to the function of hydrochloric acid, we find that the acidic environment is necessary for the cells which secrete pepsinogen, and also the acidic environment will kill most of the microorganisms in the food, and the acids will also help to denature the proteins. And what we mean by denaturation is that the protein is going to be unfolded, and by unfolding the protein, it'll increase the surface area to volume. So more surface area is going to be exposed, and so the various enzymes can break down the proteins. And as mentioned previously, the salivary amylase and other salivary enzymes will be inactivated by the acidic environment, and that is the reason why you need enzymes which can work in the acidic environment, like gastric lipase. And when you eat plant matter or meat, we'll see that the stomach acids can help break down the connective tissue, and also which is found in the meat and also other plant matter as well. Okay, so with that, we can move on to what are the various factors which influence the stomach contents to move into the small intestine, right? And that is called gastric emptying. But let me just quickly move to summarize what we discussed. We'll talk about factors influencing gastric emptying when we come back on Wednesday. So we talked about how digestive processes are mediated by activation of the parasympathetic nervous system, and we also saw how saliva is secreted during the cephalic phase. It has both digestive and protective roles, and the protective roles is to prevent dental cavities. And I showed you how dental cavities can be prevented both by fluoride and also by proper brushing technique and by xylitol. And we saw the journey of the bolus from the mouth to the stomach, and we discussed how that happens through peristalsis. And we also see that choking can happen if you have a dysfunction of the epiglottis, and we saw how a dysfunction of the lower esophageal sphincter can lead to acid reflux. And we considered some of the gastric secretions which play a role in chemical digestion, and they can play a role also in mechanical digestion by causing the contraction of the stomach walls. And when we come back on Wednesday, we'll see what are the various determinants involved in gastric emptying, right? So